I'm Caitlin White, and I will be doing the ENT exam today. This is the room that I am going to be doing it in. I guess I'll show you a little bit. And then I'm going to use the Rosenbaum and the checklist, as well as a few other items here. Hello, my name is Caitlin, and today I'm going to be performing the eye, ear, nose, and throat exam on you. Is that okay?
Mm-hmm.
Great. So we're going to start with checking your eyes first. We are going to check your eye movements, visual acuity, and inspecting the inner eye today. First, I'm going to check your visual acuity. I see that you're wearing glasses. Are they corrective lenses? Perfect. I'm going to have you keep those on. I'm going to give you this. It's called the Rosenbaum chart. And I'm going to have you close one of your eyes and read the smallest line that you can.
937826.
Great. And then close the other eye and do the same thing.
374258.
Great. And now with both eyes open, I'd like you to read them, the smallest line you can backwards.
628739.
Perfect. So your visual acuity is 2030 OD, 2030 OS, and 2030 OU with correction. Next, I'm going to check your visual fields. I want you to please look straight at me, and I'm going to pull my fingers from the sides of your face, and I want you to let me know when you can see them when they come in your visual field, okay? Yes? Good job. Now I'm going to do the same thing for your upper and lower quadrants. Perfect. Now I'm going to have you cover your right eye with your right hand, and I'm going to wiggle my fingers from the side kind of across, and I want you to let me know when you see them, okay?
Mm-hmm. Mm-hmm. Mm-hmm.
Now cover the other eye.
Mm-hmm. Mm-hmm. Mm-hmm.
Perfect. Excellent. Your visual fields are full by confrontation. Now I'm going to inspect your eyes, including your eyelids, your lacrimal apparatus, conjunctiva, and your sclera. I'm just going to remove your glasses for this. Just going to set them over here, and I'm going to touch your face just so you know. I'm going to just look at your, okay. Your eyelids appear to be symmetrical. There's no drooping or swelling. I don't see any redness, swelling, or exudate coming from your lacrimal glands. I'm just going to gently pull down. Your conjunctiva is pink and clear. Your sclera is white. Can I have you look from side to side and up and down for me? Perfect. Everything looks great. There's no redness or irritation noted. Now I'm going to look at your pupils. I'm going to use my pen light. I'm just going to use this for my light source. And I'm going to look for any opacities or anything. So I'm just going to shine this in from the side of your eye. Okay. There is no opacities noted bilaterally. Now I'm going to check your direct and consensual response to light. So I'm going to shine the pen light in one eye and then look for constriction, and then shine it in there again and look at the other eye and see if the other eye constricts too. I'm going to do that to both eyes. Okay, and then I'm going to do it again and look at the other one. Perfect. Okay. Perfect. Now I'm going to check for accommodation. I'm going to have you look at a distant object, and then I want you to look, so kind of look at a distant object, and then I want you to look back at my pen light. Right, ready? Great. Your pupils are equal, round, reactive to light, and accommodation. Now I'm going to check your corneal light reflexes with my pen light. I'm just going to shine my light into your eye and see if there's any light that reflects. Okay, perfect. I can see light reflecting slightly nasal to the center, and the pupils are both normal, and which is a normal finding. Now I'm going to check your extraocular movement. So I'm going to have you cover one of your eyes, and I'm going to, oh, actually, don't cover your eye. Just look straight at me, and I'm going to kind of make an H, and I want you to just follow my finger with your eyes. Great. Perfect. Your extraocular movements are intact and symmetric, and no nystagmus or lid lag. Now we're going to perform the cover-uncover test. This helps for me to check for eye deviation. So I'm going to have you please look straight at my nose, and I'm going to have you cover one of your eyes and then uncover it quickly, and I'm going to see if your other eye moves. So 1, 2, okay, now do the other one. Perfect. There was no eye deviation noted bilaterally. Lastly, I'm going to perform the exam, and I'm going to look at the structures in the back of your eye with the light source. Normally I would dim the lights, but for the purpose of this exam I'm going to keep the lights on just so you can see what I'm doing as well. So I'm going to have you kind of, please focus kind of like up over my shoulder a little bit, and I'm going to kind of shine this into your eye kind of off to the side. Great. Now I'm going to look for red reflex, so I'm going to kind of get closer to you as I'm looking for, so I can see the red reflex in that eye, and I'm going to look in this eye too. Perfect. Red reflex is present in both eyes. Now I'm going to get a little closer. I'm going to inspect the optic disc and the retina. I'm going to look at the arteries and the veins and the arteriovenous junction for any lesions, hemorrhages, or exudate. So I'm going to kind of get closer to you here and look at your eyes. Can I have you do the same thing? Kind of look. Great. I'm going to do the same thing to the other eye. Great. Both optic discs are yellowish pink and clear with a clear outline. The arteries and veins are clearly distinguishable. The arteriovenous junction is normal. There's no lesions, masses, hemorrhages, or exudate noted. Now I'm going to look and move along to the ears. So I'm just going to first off palpate the ears. I'm going to look at the auricles. I'm looking for any tenderness, any bumps. I'm going to look behind the ear and the tragus, and on both sides just kind of palpate them. Make sure there's no tenderness. Is there anything tender? No? Great. So your auricles and your tragus are without deformity, masses, or nodules. There are no tenderness or edema. And then the mastoid process, I'm just gonna, is that tender at all? No, no tenderness noted in the mastoid process. Now I'm going to take a look inside your ear canal. I'm just gonna use one of these on here. And so I'm just gonna kind of pull gently up on your auricle and kind of backwards to straighten your ear canal. I'm going to insert this light into your ear, and I'm just going to look for your tympanic membrane and your eardrum, okay? So I'm going to make sure I anchor it. Great. Now I'm going to do the other one. I'm going to Great. Your ear canals are clear. The tympanic membrane is pearly gray and translucent and visible light reflux. No perforation noted bilaterally. Now I'm going to do the gross auditory acuity whisper test. I'm going to come behind you about 2 feet, and I'm going to have you plug one of your ears, and I'm going to whisper a word, and I want you to tell me if you you know what the word I'm saying. So plug one of your ears.
Football.
Yep. And now the other.
Baseball.
Perfect. You answered both words correctly. Your hearing is intact bilaterally. Now for the Weber's test, I don't have a tuning fork, but I'll just kind of go over how we would normally do it. I would strike my tuning fork and I would place it on the patient's head, and I would tell them to tell me if the sound was equal in both ears or if they heard it in one ear or the other more. And then we'll say in this case the patient says it was equal, so equal Weber's test. So there's no lateralization. Next is the Raynaud's test, where we use this tuning fork as well. I would strike the tuning fork and place it at the mastoid process and have them tell me when they stopped feeling the vibration, and then I would immediately hold it next to their ear and ask if they heard the sound. I would do this on each side, and if after they stopped feeling it and they could still hear it, that would be a positive Raynaud's test. This is a normal finding, which means air conduction is greater than bone conduction, meaning the conduction is bilaterally intact. Now we're going to do your sinuses. I'm just going to go ahead and palpate the outside of your nose, looking for any tenderness or deformities. Any tenderness? No? Okay. Your nose is symmetric without lesions, deformities, or tenderness with palpation. So I want you to, I want to check your patency. So could I have you cover one of your nostrils and breathe in for me? Now the other. Perfect. Nasal patency is equal and unobstructed bilaterally. Now I'm just going to shine a light. I'm going to get a new tip, and I'm going to shine the light in your nostrils just to make sure that everything's looking good there too. Awesome. Your nasal mucosa is pink and moist, and your septum is midline. Now I'm going to palpate your frontal and maxillary sinuses. So first I'm going to palpate your frontal sinuses. Is there any tenderness? No. And then I'm going to do your maxillary sinuses. Any tenderness? All right, perfect. No masses or tenderness noted in your frontal or maxillary sinuses. Now I'm just going to start with your nose or your throat, your mouth and throat. So first I'm going to just look at your lips. They are pink, moist, no lesions, no scaliness, no cracking. So that looks good. Now I'm going to have you open your mouth, and I'm just going to kind of move my tongue depressor around, look at your oral mucosa, just making sure there's no lesions, pigmentation issues or anything like that. So let me get my light turned on. And I'm going to use my left hand for this. So just kind of looking. I'm going to move your cheeks out of the way. I'm looking at your teeth. And then can I have you put your tongue out and lift your tongue up? Perfect. Awesome. And then can I have you say ah for me? Ah. Perfect. So your oral mucosa is pink and moist without any pigmentation, ulcers, or white patches. Your gingiva is pink without any swelling or bleeding. Your teeth are in good condition, no obvious caries or missing teeth. Your hard and soft palate is pink and intact. Your uvula is midline, and your pharynx is pink and without any swelling or exudate. Your tongue is pink and symmetric without lesions, and your tonsils are present without any swelling, and your soft palate rises symmetrically, and your uvula rises symmetrically as well. Lastly, we're going to do the lymphatic. I'm going to check your lymph nodes. I'll name each one as I palpate it in rubbing in a slowly circular motion. So please tell me if you have any tenderness while I'm palpating. So now I'm going to check your pre-auricle nodes, which is just right in the front of your ears. Any tenderness?
Mm-mm.
And then I'm going to do the post-auricle, which is right behind the ears. Any tenderness?
Mm-mm.
And then I'm going to do the occipital node, which are located at the base of the skull. Any tenderness?
Mm-mm.
Okay. And then I'm going to do your tonsillar nodes, which are right kind of at the mandible here. Any tenderness?
Mm-mm.
Then I'm going to do your submandibular nodes, which are just right under your chin. And then your submantle, which is right under your chin. And then I'm going to do your superficial cervical node, which is kind of right here. I'm just going to go down, make sure I move your shirt out of the way a little bit. Okay, and then I'm going to do your anterior cervical, so I'm going to do those one at a time because they're pretty close to your carotid. And now this side. And then I'm going to do your posterior cervical, which is just kind of, and then your supraclavicular, which is right above your clavicles. Any tenderness?
Mm-mm.
And then right underneath, your inferior clavicular. No tenderness in any of those? All right, all of your lymph nodes are non-palpable and non-tender. This concludes our exam today. Do you have any questions?
I do not.
Thank you.
Thank you.